What are the best exercises for hip impingement? If you have hip impingement, you may have trouble with activities like going down into a deep squat or getting up from a low chair or bending down to put your shoes and socks on. I'm Dr. Dave Candy, and in this video, I'm going to explain what causes hip impingement or femoroacetabular impingement, as well as 5 different exercises that you can use to relieve your hip pain and improve your mobility. Now, if you find this video helpful, give it a like and subscribe to our channel. We help people to stay active, mobile, and healthy without relying on pain medications, injections, or surgeries. So before we get into the exercises for hip impingement, it's helpful to understand a little bit about what hip impingement is and what causes it, because that will help you make more sense of why we're doing the 5 exercises that I'll show here in a little bit. So hip impingement is when there's a variation in the anatomy of the hip joint. And you can have a couple different kinds of that. You can have a cam type impingement where the ball of the hip joint has a little bit of extra bump of bone on it. And so when you go really deep into a hip flexion, adduction, or internal rotation, or especially when you combine those motions, you get a pinching of that ball up against the rim of the socket of the hip. Now, the other part of hip impingement is the socket, the acetabulum. That's the femoroacetabular impingement part. And if you have an overhang of the socket, if the socket is too deep and it has a little pincer that hangs out, that's called a pincer type of hip impingement. And if you have a pincer type of hip impingement, the same symptoms are going to come up when you go into positions of flexion, adduction, and internal rotation. Now, the test for hip impingement is actually that position where you lay on your back and you go up into flexion, adduction, and internal rotation. And if you get a pinching sensation right in the front of the hip as you're going into that flexion, adduction, and internal rotation, then that's a positive test for hip impingement. Now, you can't fix the anatomy of your hip joint without a surgery. So you may wonder, is it even possible to heal from hip impingement without needing a surgery? And the answer to that is in most cases it is. That you may have had that anatomical variation all of your life or most of your life, and you may never have had symptoms. But if you have poor mobility in the capsule around the hip, that makes the ball of the hip glide a little bit more forward in the socket. And as you're going upwards, you may either glide too far forwards or too far upwards with the ball of the hip, and it can cause some pinching between the ball and the socket. So if you can improve the mobility of the capsule that sits around the hip joint, you can actually make some more room for the ball to move inside the socket without getting that pinching. So that being said, what are the 5 different exercises that I'll show for hip impingement? I'm going to break those down into 3 categories. The first category is going to be indirect hip flexibility exercises. The second category is going to be direct hip flexibility exercises. And then the third category is going to be strengthening exercises. So starting with those indirect exercises, what exactly does that mean? Well, I mentioned before that the impingement position for your hip is flexion, adduction, and internal rotation. So indirect exercises are exercises that go away from the direction of restriction. So in this case, that means going into hip extension, going back that way, hip external rotation, or hip abduction, where you move your legs out to the side. So the first exercise that I'll show is a hip flexor stretch. And this is important that if you have too much stiffness in your hip flexors, it tilts your pelvis forward and it brings that rim of the hip socket or acetabulum down. And so you can't get as far into a squat if your pelvis is too far tilted forward like that as you can if it's not tilted forward. So this first exercise is to improve the flexibility of your hip flexor muscles. Your iliopsoas, which runs from your spine and your pelvis down to the hip socket, as well as your rectus femoris, which is a quad muscle that runs up your thigh, crosses the hip joint, and attaches to the pelvis. So to do a hip flexor stretch, you're going to kneel down on one knee, and the side that you're having symptoms on is the side that you want down on the floor. Now, you want to roll your pelvis underneath of you. This kind of flattens your lower back out, and then push your pelvis forward until you feel a stretch in the hip flexor, in the front part of that hip joint. And then hold that position in a comfortable stretch for around a minute. Now, you don't want to go too far like this. At this point, you're really just arching your back. You're not getting any more extension out of the hip. So it's important to roll your pelvis underneath of you, and then just push the pelvis forward so you feel a comfortable stretch in the front of the hip and thigh. So that's the first indirect exercise, meaning going away from the restriction. Now, the second exercise for hip impingement is going into external rotation. And you can do that as a piriformis stretch. So if you have trouble getting up into this position because of hip impingement, start out going into external rotation and then bring your leg up. Now, if you really, really have trouble doing that, you can also put your foot up on an ottoman or a stool, or just sit with it out to the side like that and start to lean forward as much as you feel comfortable going. But if you're able to get your hip crossed like this, then just lean forward into it until you feel a stretch in the back part of your hip. And this stretches out the muscles that are in the back of your hip that prevent the ball of your hip or the femoral head from gliding backwards in the acetabulum. And if you improve the flexibility in the back part of your hip, then when you do go into a squat or you go to bend forward to tie your shoes, then the ball can glide backwards in the socket and you're not as likely to pinch on that front rim of the hip. So that's the second indirect exercise. And again, you want to hold this for around a minute to 2 minutes. Now, the third exercise is for your inner thigh or groin muscles or hip adductor muscles. Remember, adduction means bringing the hips together, and that adduction is part of the impingement position. So to stretch out those adductors, you can use a groin stretch. So to stretch out those adductors, you can do a groin stretch. And to do that, you can do that either on a bed or a couch, sitting back like this, and pushing your knees out to the side, and just holding in a position like that, or getting down on the floor, keeping the knees wide, and pushing out to the side like that. Now, just go to the point that you feel comfortable. You don't want to push too hard and cause a groin strain. Just kind of slowly sink into the stretch. And over time, you should be able to get your knees down a little bit farther towards the floor. So those are the three indirect exercises if you do have a hip impingement syndrome. Now, the direct exercise, the direct flexibility exercise that I'm going to show means you're actually going into the restriction. So remember that restriction is in hip flexion, adduction, and internal rotation. And to do that, I'm going to show you a stretch on all fours. Now, when you have your body weight on all fours on the ground like this, the weight of your body is kind of pushing the head of the femur backwards in the hip. And so you're already kind of getting a little bit of a joint mobilization to your hip just by your body weight being stacked on top of your femur here. Now, when you do a rocking back stretch like this, when you're doing a stretch in yoga, this is called the child's pose. But notice the lower back can round out here, and you don't necessarily want that if you want to improve the mobility of the hip. So you may have to actually tilt your pelvis forward, which remember before I said don't do that. But now we're actually going into the direction of the restriction, and then just locking up this exercise so that you feel it in the hip joint. Now notice this isn't a huge range of motion at this point because we're just trying to localize the movement to the hip joint without getting the lower back involved. And if you tilt your pelvis forward and then just push back till you feel a slight stretch in your hips. Now, if you start to get pinching in the front part of your hips, you don't want to push it on this one because that's actually causing the impingement symptoms. And you don't want to create more symptoms when you're stretching. So just go back to the point where you can comfortably and then hold that stretch. Now, if you need to, you can spread your knees out a little bit wider or externally rotate and abduct your hips a little bit. And that'll allow you to get a little bit deeper down into the stretch. That also kind of stretches your groin a little bit. And just rock back into that position. Now that builds up into more of a squatting position, which people a lot of times have trouble with if they have hip impingement. And so that brings us to the strengthening exercise for hip impingement, which is actually just doing a deep squat or going down into that. So when you're first starting to do exercises for hip impingement, you want to avoid going into deep squat positions because that can pinch the acetabulum and the femur together. But you want to start getting into that position eventually. So to start, you want to get your back in a flat position, then just practice sitting back and hinging at the hips a little bit. And just going through that first portion of the motion there. Keep the weight on your heels, and then just go down as deeply into the squat as you can comfortably, keeping your lower back relatively flat. You don't want to allow it to arch like this. So keep your lower back relatively flat. Now turning your knees out or externally rotating and spreading your feet farther apart, abducting your hips can also give you some more clearance in the squat so that you can get down a little bit deeper. If you're making your toes point straight ahead and feet shoulders width apart, you may be a little bit limited by pinching in the groin here. So it does help to turn your toes out just a little bit, spread your feet a little bit wider, and then come down through the range that you can comfortably. Now, over time of doing this exercise, you can get deeper down into the squat. Now, that's probably not going to happen in a single session, but working gradually through those other flexibility exercises first, and then progressing down into your squat as far as you feel comfortable going will help you to improve your hip mobility and your hip strength of your gluteal muscles over time. So those were the 5 exercises for hip impingement. I hope you did find those helpful to help you move better without having as much pinching pain in the front of your hip. Now, if you happen to be in St. Louis and you need more help for hip impingement pain, just contact us at More for Life and we'd be happy to help you. And if you're watching this from somewhere else but you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching and have a great day.